Hi Casey, how are you?
I'm good, how are you?
I'm good. So I see here that you've been having some back pain.
Yeah.
Can you tell me a little bit about what happened?
I was in a car accident about 2 weeks ago, and my upper back is starting to hurt, and it radiates towards the middle of my back.
Okay. Did the symptoms start 2 weeks ago, or was it after the accident?
It was after the accident.
Okay. So would you say the pain has been around for a week, longer than a week?
I think it's been about a week and a half that it started to develop.
Okay, so maybe 3-4 days after the accident?
Yeah.
Okay. How would you rate the pain?
I would say it differentiates from a 4 to a 6.
Okay. Have you noticed any pattern that maybe it gets worse in the morning or worse at night?
Yeah, absolutely. It's always worse in the morning when I wake up. I try to stretch. Sometimes I feel tingling.
Okay. Any numbness?
No.
No. Do you ever feel like it radiates down to your legs or maybe your arms?
No.
No. Would you describe the pain as being like a sharp pain or a dull?
A sharp pain.
Sharp, okay. Okay, very good. I'm going to take a look at your back. Okay, I'm going to start by asking you to make a few movements for me with your neck. You can go ahead and move your, try to touch your right ear to your right shoulder. Is there any pain as you do that?
Yeah, a little bit of pain.
Yeah. Do you think it gets worse when you do that, or it's just a regular pain that you've been feeling?
It gets worse when I do that.
Okay, let's try the other side. Okay.
That one feels fine.
Okay. Can you go ahead and try to touch your chin to your chest? Do you feel a stretch or a pain or something?
Both.
Both, okay. You can go ahead and try to look up. Okay. Any?
That's uncomfortable.
Uncomfortable, okay. How do you usually sleep?
I sleep on my side, specifically my left side.
Okay. I'm going to start assessing your spine. I'm going to be palpating each one of your vertebrae. I'm looking for any inflammation that I can detect. Okay. Would you say this is where the pain radiates from?
Yeah.
Yeah, I can feel a lot of inflammation around C5. C6 and C7. As I start getting down into your thoracic spine, definitely the inflammation is a lot less. Okay. Lumbar spine. It feels in good shape. No inflammation in this area. Is there any pain at all in your lower back? Okay. I'm going to be tapping very lightly. I'm just looking for any neurological abnormalities. If there's any excessive amount of pain, let me know. It shouldn't really hurt too much. Can you tell me if you can feel this?
Yeah.
You can just say yes when you feel it.
Yeah. No. Yeah. 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 Yes. 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 Yes.
Okay. Okay. Do you feel that?
Yes.
It should feel like a vibration.
Yes.
Okay.
I did not go.
Right now, do you feel it?
No.
Barely. About now?
Yes. No. Yes. 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 Yes.
Okay.
Yes.
Okay, can you tell me if you feel this?
Yes.
When do you stop feeling it?
Stop.
Let me know when it stops.
Stop.
Okay. Place this here. Can you feel that?
Yes.
Let me know when it stops.
Stop.
Can you feel that?
Yeah.
Let me know when it stops.
Stop.
Okay, very good. Okay, I'm going to be taking a few measurements. Make sure that symmetry of your spine was not compromised. Okay. 18.5. 20. 24. Checking your scapula, relation to your spine. And I have 6, 5. So there definitely is a little bit of misalignment of the spine. However, the curvature of it looks very healthy. No signs of scoliosis. So that is great. Okay. I'm going to do an examination of the skin on your back as well. Make sure I don't detect any bruising, any lumps. It's just helping me detect any changes of elevation, so it's gonna help me detect any lumps under the skin. Okay, good news is that there are no lumps, masses, anything abnormal under the skin. But I do find a lot of inflammation in this area alongside the spine and then also around the scapula. Let me take a look, see if I can detect any abnormal changes in the skin. Looking with the UV light as well. Yeah, I don't notice any significant abnormalities on your skin. There is some dryness and scaly areas, but that's totally unrelated. You should be able to take care of that with just some moisturizing lotion. I'm going to do some light adjustments on your spine. Don't want to go too hard just because your spine or your muscles on this area, they are swollen. Let's try to see what we can do to help your alignment. Okay, first I'm going to do your right shoulder. Just assessing the movement first. Can you hear a little clicking sound? Do you hear it?
Mm-hmm.
Right there. Does that hurt?
No.
Okay, I'm going to ask you to take a deep breath. Exhale. Okay. You can go ahead and try to touch the mid of your back with your hand. Like that. Like that. Trying to feel through your scapula. Yeah, definitely. A lot of inflammation here. Okay, you can go ahead and relax. Go to the other side. First, I'm just looking at the movement. There's no clicking sound on this side. Okay. Can you go ahead and take a deep breath for me? Exhale. Okay, now let's try to touch your back the same way as we did. So I think your right side is more flexible than your left. Okay. Now can you try to touch both of your hands on your back? Let's see how that. Okay. Okay, go ahead and relax. think there is some localized swelling in this area that I want to try to address. I'm going to be applying some pressure. I know there's an excessive amount of pain, it might feel a little bit uncomfortable. Okay, I'm going to reassess the symmetry of the spine. Definitely think those little adjustments we did are going to be of great help. Scapula. Okay, that looks symmetrical. Do a little bit of pulling on your skin along your spine. Just trying to release any accumulated tension. address the scapula as well. Okay, the swelling along your cervical spine is definitely decreased, so this should help a lot with the pain. Okay, Kasey, we did a lot of work on your spine. There was a lot of inflammation, and there probably still is, but it did feel like it improved a lot. Okay, absolutely. So I would say just wait a couple more weeks and see how you're feeling. I think this is really going to help. If the pain is still there, even if it's just a little bit of pain, please call me and I'll see you again. Okay?
Absolutely.
Okay.
Thank you.
Do you have any questions?
No.
Okay, sounds good. Thanks.